Hello everybody, my name is Gert Ossenkoppele. I'm a hematologist located in Amsterdam. And today I will address the question, does 10 days decitabine improve post-transplant outcomes in all the patients compared with conventional 3+7 chemotherapy? And there is an answer on this question because the ERTC leukemia group presented at the latest EHA 2022 phase 3 randomized trial comparing those regimens in elderly patients above the age of 60 years who were fit for chemotherapy. And they, to answer that question, they randomized around 600 patients divided in two groups. One group was treated with the 3+7 and the other with a 10 days regimen of decitabine. And the composition of those groups was well balanced. The median age of the group was 67 years in the decitabine treated patients and 68 years in the 3+7 treated patient. There was the patients were well balanced in both groups. There was a little bit more NPM1 mutated patients in the decitabine group, and also the favorable chemotherapy were a little bit overrepresented in the decitabine group. But nevertheless, there was no real statistical difference between the two groups. Most of the patients in the 3+7 group received 1 or 2 induction courses. This was different in the decitabine group. Most of those patients received more than 3 patients up to even 41 cycles of chemotherapy. So that was really different. The complete remission rate was also in favor of the 3+7 group, 61% compared to 48%. It was CR and CRI. And the difference was most pronounced in the age group between 60 and 65 years of age. And the primary endpoint of the study was overall survival. And for example, at 4 years, there was no statistical different survival benefit for one of the arms. The 4-year survival in the 3+7 arm was 30%, and in the decitabine arm, 26%. And in a multivariate analysis, there was only an advantage for the 3+7 in the younger age cohort, so in the patient group between 60 and 64 years, and in the NPM1 mutated patients. So the side effects were also less present in the decitabine arm in comparison to the 3+7 arm. And in terms of health economics, also there was an advantage for the decitabine treated patient in terms of hospitalization duration and usage of intravenous antibiotics and transfusion needs. So the conclusions of this study were that the outcome of the study in overall survival between the two arms was similar. Patients above the age of 70 had a longer overall survival with decitabine compared to the 3+7, and the patients between 60 and 64 years or with the NPM1 mutation had a shorter overall survival compared with decitabine. So overall, 40 to 50% of patients were achieved an allogeneic stem cell transplantation in both arms, in the decitabine arm and the 3+7 arm. So the bridge to transplant was well feasible in this European trial. So this is really an important trial, starting, as I mentioned already, many years ago. And in the meantime, a lot has changed in the treatment of acute myeloid leukemia patients. But it's good to know that a hypermethylating backbone of treatment, even in the fit patients, could bridge patients to an allogeneic stem cell transplantation. And as you all know now, the treatment in combination with an hypermethylating agent with, for example, venetoclax is much better. It is also leading to achieving an allogeneic stem cell transplantation in quite a number of patients. So And in this trial, molecular data was not complete, and we did not see minimal residual disease data. Maybe in the final manuscript that probably will appear soon, we can read this. And with that, I would like to thank you for your attention.